Hello, my name is Lisa Clark and I am going to show you flushing the central line. I have my supplies and I'm going to set them down on a clean surface. I'm going to introduce myself to the patient and I'm going to check the physician's orders and make sure that this is the procedure that needs to be done. I'm going to ask the patient for a name, date of birth, and if he has any allergies, and also check his file for allergies. And then I'm going to gather my supplies, which I have 3 10 cc normal saline solution syringes because there are 3 lumens, 3 alcohol wipes for each one, and I would have a 5 cc normal saline syringe if it was for a peripheral line. I would also have Curo caps per hospital policy. I would explain the procedure to the patient, and then once I did that, I would go and wash my hands or disinfectant. And then I'm going to look at the site for swelling, redness, or warmth, and it looks really good. I'm going to get my supplies ready. Okay, and I would then unclamp the central lines. If they were clamped, they would be unclamped. I would hit the pause button if it was an IV pump, and I'm going to show you the IV flush first. And so what I would do is I would pick the valve distal to the patient, and I would pinch it. And once I have hold of the IV line, I would want to make sure that I keep it in my hand. I would want to clean the area for 15 seconds. And then let it dry, air dry. And I would get my first saline. Pinched. I would want to expel any air bubble. And then connect it into the valve, turning it clockwise. And then I would inject 2 to 3 milliliters of saline. And if I met any resistance, I would immediately stop and aspirate and look for blood return. If it was brisk or if it was sluggish, I'd want to make a note of that. As I am doing the push-pause method, creating turbulence, 2 to 3 mils each time, I'd be looking at the site for swelling, for any kind of issues that might come up. And also looking at the patient to make sure the patient is tolerating it. Once I'm done, I would want to unclamp or unpinch the line, hit the pause button on the pump, and then release my syringe. And then I would take my Curo cap per hospital policy and I would put it on top of the valve. And then if I was going to do the next central line, I would be doing both of these the same way. I would want to, again, just double check and make sure that this is unclamped. I'd want to get the valve and do the same thing that I did for the IV. I want to clean the valve for 15 seconds. And then I would want to expel any air, the air bubble, gently and slowly. Put the syringe into the valve, turning it clockwise, and doing the same thing that I did for the IV, where I would push in 2 to 3 mils, looking at the site for patency, And if I met resistance, again, I would want to aspirate and look for blood. And then it's going in fine, so I would just continue 2 to 3 mils. And then before I remove the syringe, I would want to reclamp the line. Remove the syringe, put a Kuros cap on the end, and again, I would do the same thing to the central line as well. Once I was finished, I would clean up my area, throw everything away, and I would make sure that the patient was comfortable, and I would document stating the tolerance the patient had to the procedure, if it was patent, if there was resistance, and if there was blood, if it was sluggish, or if it was brisk. And then I would wash my hands.